All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. So the discussion today is the omega-3, its food or dietary sources and non-dietary sources, and then the difference in the quantities that you need to take to have a decent daily intake of omega-3. So I'm going to go over, number one, the recommendation of adequate daily intake. Then I'm going to go over various foods and various supplements that may have various amounts of omega-3s, and you can actually decide from there, being a vegetarian, non-vegetarian, and so on. You can look at the foods there and decide which one suit you the best. And then I'm going to actually show you the worked examples of how much daily quantity will be needed for various foods that you would need to consume to have the daily adequate intake. I have actually then created an Excel sheet as well, in which I have done all of this work, and at the end of this video I have a couple of slides with those worked examples table as well. So let's start with our discussion. First, the references. So let me show you. So this is Drbeen.com. If you do not have access to it, imagine that there are another 800 amazing medical lectures, so just go to Drbeen.com. There is actually a link in the description of this video that would give you access to Drbeen.com at a very inexpensive price. So that is one. Then here is the National Institute of Health, and this is their Office of Dietary Supplements, and I'm going to use table number 2 from here and table number 1 and 2 from this this article. I'm also going to use some references to various studies that they have done to provide you some more data. Then here is the worked example that I have done. This is another reference, this is one more reference, and this is one more reference. So before now we look at my diagrams, I want to actually read for you some of the daily usage. So if you start from here, and I'm going to discuss this a little later, but if you see here in the table 1, they say that adequate intake. So notice that they do not use the word recommended daily allowance because there is no RDA. So they're just simply saying adequate intake. So here they start from 0.5 gram per day of ELA. So this is become clear in a second. There are 3 omega-3s that are important for us: ELA, DHA, and EPA. Although DHA and EPA are practically the correct ones, or the ones that are needed by most of the cellular functions, ELA, once we consume, becomes converted to DHA and EPA. So, and only 1 to 5% is converted. So keep that please in mind. So this is the ELA's allowance, anywhere from 0.5 to 1.6 gram based on gender and age. Then this is the table with the ELA, EPA, and DHA content per selected food. But what I am more interested in is the following. So in this article, this is one of the best articles I've seen. Very less bias and very less confusion they have created, which you see that many other articles and presenters have created a lot of confusion. So this is pretty straightforward, and I like this one with the references over here. So initial clinical research. I am interested in presenting to you the what is that? The daily intake. So here 1.8 gram daily EPA. So once again we have ELA or ALA, DHA, and EPA. Most of the foods will tell you that there is omega-3, but that would be ALA. You have to look at the DHA and EPA, because if there is ELA or ALA, that would only be converted from a ratio of 1% to 5%. So here, daily need was 1.8 gram per day of EPA in this study, plus statins. And then if you see here, this is another study where they say supplementation with 1 gram per day omega-3s, 375 milligram DHA, and 465 milligram EPA for about 6 years, significantly lower triglyceride levels, but no effect on the risk of myocardial infarction, stroke, or death from cardiovascular causes in comparison with placebo. Then if you see here, Again, there are some studies that showed good results, that there are some that did not. What I am hoping to present to you is the dosage used. So here, look at this one. This is the vital study, and here both trials, so they had this Ascend and Vital trial they're talking about. Both trials compared the same 1 gram per day omega-3 formulation, which once again notice is 460 milligram EPA and 380 milligram DHA. So there is no ALA they're talking about, with placebo. But in different populations. Vital included 25,000 men age 50 and older and women age 55 and older with no previous heart attacks, strokes or cancers, whereas Ascend included 15,480 adults age 40 or older with diabetes but no evidence of cardiovascular disease. Vital also tested the omega-3 supplement with and without 2,000 international units of vitamin D. So if you see here, however, participants taking the omega-3 supplement did experience a statistically significant 28% reduction in total myocardial infarction rates, including, notice this, a 77% reduction among African Americans and a 40% reduction among those who consumed less than 1.5 servings of fish per week. Supplement users also had significant reduction in rates of fatal myocardial infarction, total coronary heart disease, and percutaneous coronary intervention. Similarly, if you see here, this is the Vasipa here is a prescription medicine. It is high dose omega-3s but with prescription. So here they have those presented here too. So IPE significantly reduced rate of cardiovascular event, a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, and unstable angina by 25%. IPE also significantly reduced rates of other outcomes including cardiovascular death by 20%, fatal or non-fatal stroke by 28%, and fatal or non-fatal myocardial infarction by 31%. So this IPE is an omega-3 that is present in Vasipa. It is more like an EPA type omega, but slightly different formula. Similarly, if you see here, this is prescription form of omega-3s containing EPA and DHA in a carboxylic acid form. This trial strength included 13,000 participants from 22 countries. And look at this one. However, the trial was stopped for particular participants were treated for a median of about 3.5 years. And look at this. This was the atrial fibrillation. So high dose omega-3s can cause atrial fibrillation and clotting, bleeding issues and so on. So please make sure that you look at the side effects. I will not be covering side effects. I want to focus this video only today on the dietary sources and the amounts needed for 1 gram of EPA and DHA on daily basis. Then this article has actually discussed at what are the possible reasons for confusing results. Then they've talked about other studies over here. Finally, I think this is also interesting to note. This is American Heart Association. American Heart Association recommends the omega-3s from on a spectrum of no recommendation to healthy individual to those who may need to be helping against the cardiovascular events, 1 gram per day or more. So if you see here, between 2017 and 2019, the American Heart Association released 3 science advisories on omega-3s. All 3 advisories recommended 1 to 2 servings of seafood, 1 to 2 servings of seafood per week to reduce the risk of congestive heart failure, coronary heart disease, ischemic stroke, and sudden cardiac death, especially when the seafood replaces less healthy foods. For people with existing coronary heart disease, such as recent myocardial infarction, the American Heart Association recommends approximately 1 gram per day of EPA plus DHA. So I guess I have made my case clear that it is 1 gram per day of EPA and DHA, especially in adults. I want to read this as well. The American Heart Association does not recommend omega-3 supplements for people who do not have a high CVD risk. I think this is not the best thing to do, but anyways, that is their recommendation. So that is what is here. Okay, so again, for triglyceride management, if you see here, each increases of 1 gram per day of LC omega 3 reduce triglyceride level by 5.9 milligram per deciliter, and so on. So you can look at this this reference a little more, beautifully written and very thorough article. Now I'm going to go to my drawings and go with the worked examples. For example, how much flax seeds do you really need every day, or how much salmon every day do you need for 1 gram of DHA and EPA, not ELA. So let's start. So omega-3 dietary sources and daily amounts. So I am going to work towards 1 gram per day of EPA and DHA. So here this is the same table I showed you before. So in this table, if you see, this is the adequate intakes, and in this one they're talking about birth to 6 months, 0.5 gram males, 0.5 gram females. Now this is ELA, alpha linolenic acid, not DHA or EPA. 7 to 12 months, 0.5. And if you see here, 51 years plus, 1.6 gram for men and 1.1 gram for women. For once again, for ELA, I really want to make sure that we can develop this sensitivity, that are we talking about ELA or are we talking about DHA and EPA. Here is the foods, and I would have some worked examples for this one, so don't stress too much, but let me just show you how this table is. This is the table 2 in that article. For example, the first line here says flaxseed oil, 1 tablespoon has 7.26 gram per serving of ELA. Now that is sufficient, or more than sufficient, from the recommendation point of view. This table with the recommendation is 1.6 gram per day of ELA, and here you are seeing 7.26 gram. However, please remember that ELA needs to be converted to DHA and EPA to be then further used for anti-inflammatory properties, etc. ELA converts to DHA and EPA anywhere from 1 to 5%. So some studies says even 5 to 10%, some studies says 1 to 5%. I believe some International Nutrition Agency, whatever is their proper name, they just say that ELA would be converted by 1%. I have used in our calculations here 5%. So that means if somebody has 7.26 grams of ELA from flaxseed oil, only 0.5% or 5% of this is going to be actually DHA and EPA, which is the practical molecule that we need. And remember, we need 1 gram of these two daily. So similarly, if you see chia seeds, English walnuts, so I have now some worked examples. For example, let's look at the flaxseed oil. This is the flaxseed oil, not the whole flax seeds. 1 tablespoon has ELA of 7.26 gram. 5% of that would be converted to DHA and EPA, and that is 0.363 gram in 1 serving. Now we are targeting 1 gram. Some of the studies you saw were going even up to 4 gram of DHA and EPA per day. So I'm not going there because that needs to be, that has side effects that needs to be discussed with the doctor, and there has to be a dietary need or supplemental need. This is just daily adequate intake in light of various studies that 1 gram of DHA and EPA is important. So here, 0.363. So that means we need to make this 1 gram, and to make this 1 gram, we would need to have 2.75 tablespoon of flaxseed oil every day to give us 1 gram of DHA and EPA. So 2.75 tablespoons. Then chia seeds, 1 ounce of chia seed have 5.06 gram of ELA. And of course, 5% of that we're taking as conversion to DHA and EPA. That would become 0.25 grams per 1 serving of 1 ounce. That means to have 1 gram, we need to have almost 4 ounces of chia seed daily to have 1 gram of DHA and EPA. Then this is the English walnut, 1 ounce. 1 ounce From an Ella's point of view, 2.57 gram, which is almost more than towards the double of the needed one in adults, age 51 plus. But 5% of that would be converted to EPA and DHA, and that would be 0.128. That means almost 8 ounces of English walnut per day will be needed to give 1 gram DHA and EPA. Once again, what is your exact dietary need depends upon your body's situation, and I had that discussion done yesterday. This is not about a recommendation for any one individual that is listening to it. This is more of a presentation to say this is how we need to convert based on our needs. So if you just take, for example, 1 tablespoon of chia seed, is that sufficient for you or not? Okay, so we're going to continue. Flaxseed whole. So this is not flaxseed oil, this is whole flaxseed. 1 tablespoon has 2.35 gram of Ella. So that means to have 5% of that converted into DHA and EPA, that would give us 0.117 gram of this serving. So that means for flaxseed whole, we will need to take 8.51 tablespoon, almost 9 tablespoon, to have 1 gram of DHA and EPA. Once again, if you decided that, hey, I just want to have 1.6 gram of Ella, which by 5% would convert to DHA and EPA, a smaller quantity, then maybe 1 tablespoon is sufficient. However, if we go for 1 gram DHA and EPA, then this would need to be 8.51 tablespoons. Salmon. Now, salmon doesn't have Ella. It actually has DHA and EPA in it directly. And salmon has the most quantity of DHA and EPA. So if you see here, 3 ounces of farmed Atlantic salmon cooked, 3 ounces, will have 1.25 gram DHA and 0.59 gram EPA, making 1.84 gram per 3 ounce of cooked salmon of DHA and EPA. Now remember, we were targeting 1, so that means you can actually take, or one can take even half of the 3 ounces, or 1.5 ounces for example, for almost 1 gram of DHA and EPA. Salmon Atlantic wild instead of farmed, cooked, again 3 ounces, 1.24 gram of DHA in it and 0.35 gram of EPA. Once again, more than 1 gram that we are targeting, total 1.59 gram per 3 ounce. So that means almost about 2 ounces per day will give 1 gram of DHA and EPA. So with this, these were some worked examples. Here I have a sheet with all of the whole table worked out. So if you see here, this is the same table as you saw in that article. Then I have calculated it for 1 gram DHA and EPA and 4 gram DHA and EPA. Once again, please talk with your doctor to take them. And once again, the examples are, for example, flaxseed oil, 1 tablespoon. To have 1 gram of DHA plus EPA, 2.75 tablespoons. Or 4 gram of DHA and EPA would mean 11 gram tablespoons. And as you can see, various type of foods and their conversion and my amount for 1 gram DHA and EPA per day. This is continuing the same table, and as you keep going downwards, you would see that, for example, there are some things that are funny. For example, bread, whole wheat, 1 slice. It only has 0.04 Ella. It doesn't have any DHA or EPA. This 0.04 gram of Ella would go into our body, will become converted to DHA and EPA, which are the functional practical parts of the omega-3 at the rate of anywhere from 1% to 5%. That would mean we'll have to take, for 1 gram of DHA and EPA from bread, we'll need to eat 500 slices every day, or to get 4 grams, we'll need to eat 2000 slices every day. So of course, that's just funny. And look at the milk as well. In the non-fortified milk, here 2000 cups or 8000 cups to give 1 gram, or to give the 4 gram. And finally, I have removed the brand from this one. I just wanted to show you, and I have no...
Celebrate the start of the weekend.
Alexa, stop. Alexa, stop. Alexa, stop. So my apologies for Alexa. So here I have taken something from Amazon. Again, I have no relationship to this company, neither am I promoting them or suggesting them, but it was interesting for me to see that this was a company with one capsule that contained 2400 milligram of DHA and 1800 milligram of EPA. Two capsules had 6000 milligram of fish oil, and of course one capsule would have 3000 milligram of 3 gram, which is kind of within the range of 1 to 4 gram that various studies have been using. And look, the price is such that only 10 cent per gram. So if you just, or someone just wanted to have 1 gram per day of DHA and EPA, then just 10 cent per day can be spent to have already prepared formulations. Of course, there are needs to understand that what kind of gel they're using. Is it vegan or not? Is it vegetarian or not? Is it grass-fed or not? So you can do that research, but I just wanted to kind of sensitize you that in the market there are various formulations available and at a cheaper cost, but natural foods are fine as well. And finally, this is the last part. Make sure to look up the side effects, because I didn't want to go into the side effects today, but you please make sure that you see the side effects and contraindication and discuss with your doctor, because this is not a medical advice. Finally, like, subscribe and share, and there are links in the description if you would like to support this work, or if you would like to become part of Drbeen.com. Come on over. The links are in the description. Thank you very much, and I would see you next week. Bye for now.